Good morning, I have Robyn Whittaker with me today to have a quick catch-up chat about her topic at Emerging Tech in Healthcare. Robyn, thanks for coming to talk to us. You're talking on mHealth, transforming healthcare. Do you want to explain a little bit the perspective you have of key transformations taking place?
Sure. So today I'm going to be talking about how I see mobile phones becoming the key integrator that allows anywhere, anytime care, basically. So all of the new developments and advances and technologies that are actually going to be using the mobile phone as the key point of integration. So your sensors and your wearables will be talking to your mobile phone, and your mobile phone will be able to integrate with other information through the web, and through that we'll be able to really wrap a comprehensive person-centred health system around each individual. And the mobile phone is really, really important in thinking about this because it really allows us to reach into all populations. So we don't want to develop services for the wealthy and the privileged that have phones, but everyone has a mobile phone. So using that, we can actually reach into our priority populations, low socioeconomic, Māori Pacific, and those who are not accessing health services in other ways.
Okay, the value of that will be phenomenal. How do you see it with our enlarging older population? My mind immediately goes to them. How do we see engaging with them around this?
Yeah, that's a good question. And so by saying the mobile phone, I'm not necessarily saying the way that we think of a mobile phone today. I don't know what it's going to look like in the future, and I'm sure that we'll be developing devices that are more easily usable and accessible by those who have eyesight problems or cognitive problems or dexterity issues. I'm sure there'll be form factors that are built for everyone. And we know that one of the great drivers for getting elderly to use tablets and mobile phones at the moment is their grandchildren and being able to keep in contact with them. So I'm sure that the use by the older population will only increase as the current baby boomers age.
Generational growth, yeah, absolutely. So in saying that and understanding that sort of breadth of scope, how do you see us, are we keeping pace with that development at the moment, or what do you see as sort of accelerators that may be needed to come into play here?
Yes, so I think a lot of the advances in the technologies are happening elsewhere, obviously, but what we're really good at is adding the value and adding the smarts and really co-designing programs that are specific to our populations, our needs and our health context. So I think that's where we need to really keep pace, is we need to keep designing really good programs that engage our population and make the most of these advances in technology without getting hooked up on having to develop everything ourselves.
I can imagine that cultural perspective of that will be obviously incredibly important.
Absolutely.
So, wonderful. So in terms of that, how do you see that panning out in parity across our health services? Obviously, as we demographic funding and we're looking to address those developments, do you see this as a national approach, or is it going to be a little bit more fractured in terms of independent organisational approach?
Well, I think both will happen. So there are some things that will make sense to be done at a national level. So providing systems that that everyone can access, basically, and that third parties and others can access is something that we need to happen at a national level. But a lot of the innovation obviously happens at a very local level, and a lot of the co-designing with our communities, with our priority populations, happens very locally. But it generally, if we design something specifically for Māori and Pacific and low socioeconomic high health need in this country, it ends up working really well for everyone. So as long as we're innovating locally but thinking about scaling up to the whole rest of the country, then I think we'll do all right.
Fantastic. Thank you. That's great. Thank you.